During the COVID era, one idea was presented to the public as a moral duty. Politicians and health officials imposed it on the population, not because the evidence demanded it, but for political motives. Masking.
Newsnight understands that the World Health Organization committee that reviewed the evidence for the use of face coverings in public didn't back them, but after political lobbying, the WHO now recommends them.
In doing so, they condemned the most vulnerable among us, in care homes and health settings, to a round-the-clock nightmare of faceless isolation many would never live to see the end of. In this film, you'll discover who was responsible. It will also reveal how this tragedy could have been avoided, had courage prevailed over cowardice and conformity at the right time.
You've completely changed the world and installed a dystopia on them that they can't get out of.
Removing facial expression for somebody with dementia who's relying almost totally on facial expression, not just for communication, but for comfort, for easing stress and distress, for easing loneliness. To remove that, I think, is just the epitome of cruelty.
As of Monday, the 15th of June, face coverings will become mandatory.
Masking, as we'll show, became a cruel injustice inflicted on those least able to defend themselves. And disturbingly, it's a chapter of history that hasn't truly ended. Without recognition of the damage done, we stand on the precipice of repeating the very same mistakes. At the UK's official COVID inquiry, Dame Jenny Harries, boss of the UK Health Security Agency, made a series of incredible admissions in her written evidence about the limited value of masking. Admissions that would astonish most people. Yet these revelations were not really a change of heart. Just days before the first lockdown, on the 11th of March 2020, Harries, then Deputy Chief Medical Officer for England, appeared on television with Prime Minister Boris Johnson and told the public the following.
Tell us about the value of wearing face masks. You see face masks around the place. Is there any point to that?
If a healthcare professional hasn't advised you to wear a face mask, it's usually quite a bad idea. People tend to leave them on. They contaminate the face mask and then wipe it over something. So it's really not a good idea and doesn't help. Harries was far from alone in dismissing the value of masking at the time.
In terms of wearing a mask, our advice is clear that wearing a mask if you don't have an infection really reduces the risk, almost none, not at all. So we do not advise that.
I was on the phone this morning to a colleague in Hong Kong who's a professor there, who's done the evidence review for the World Health Organization on face masks. And we're of the same mind that there is no evidence that general wearing of face masks by the public who are well affects the spread of the disease in our society. Yes, it is true that we do see very large amounts of mask wearing, particularly in Southeast Asia. But we have always seen that for many decades, and it is entirely wired into some cultures that masks are worn quite frequently. So it's very different. But in terms of the hard evidence and what the UK government recommends, we do not recommend face masks for general wearing by the public.
How is wearing a mask counterproductive in public?
I think a couple of ways, maybe even three. One is, as you say, the suggestion is that people could even make their own masks and its clothing and that sort of thing, which doesn't really provide much protection. Secondly, the way that people take it off can sometimes do the reinfection. Thirdly, that it can provide a false sense of security.
The evidence on face masks has always been quite variable, quite weak, quite difficult to know exactly, and there's no real trials on it.
The experts were so united in their anti-masking stance that the ASA, the Advertising Standards Agency, banned the adverts of two companies for misleading claims that their face masks would protect against coronavirus. NHS Medical Director Professor Stephen Powers applauded this move, stating, "Callous firms that look to maximise profits by pushing products that fly in the face of official advice is outright dangerous and has rightly been banned." Then, all of a sudden, everything changed.
As of Monday the 15th of June, face coverings will become mandatory on public transport. That doesn't mean surgical masks, which we must keep for clinical settings. It means the kind of face covering you can easily make at home.
A day later, the government announced that staff would be required to wear surgical masks, and visitors and outpatients so-called face coverings in all NHS hospitals. Masking became the norm in health and social care facilities for at least 2 years and proved hard to shift. Even nearly 5 years later, as of early 2025, some hospitals in England were still attempting to impose their own mask requirements on staff and visitors. Many professionals in the medical field recognised it was ridiculous from the start. Dr. Tony Hinton, a surgeon with 30 years of experience, was amongst them.
Even the Danish mask study, where they taught people how to use the masks, gave them a box of clean masks to use every day and change every 4 hours, that showed no benefit from masks. I think the masks there are for two reasons. Some people like to use it as a virtue signalling, to say they're nicer people than some other people. I've never worn a mask outside work, not ever, not anywhere, because it's scientific nonsense and I won't kowtow to it.
Well, I just thought it was completely ridiculous because even in healthcare settings, we generally don't wear masks, only for very specific problems that we have. So, for instance, one of the things that kept coming up during COVID was, well, if masks don't work, why do surgeons wear them? Well, yes, if I'm operating on a patient where there might be patient's body fluids or blood splashing in my face, yeah, I'll wear a mask. And I'll also wear a large pair of glasses to protect my eyes. There's only very limited reasons why healthcare staff wear a mask, and it's generally to protect themselves from body fluids and blood. It's not to protect themselves from a virus floating around in the air. It won't do that. In the surgical mask, the holes in the surgical mask are about 1,000 times bigger than a virus particle. So there's no way any of those masks stop a virus going through from one side to another. They were completely pointless.
So what's going on?
The debate is deeply political. Newsnight understands that the World Health Organization committee that reviewed the evidence for the use of face coverings in public didn't back them. But after political lobbying, the WHO now recommends them.
BBC Newsnight science correspondent Deborah Cohen tweeted about the political lobbying behind masking policies, though the tweet has since been deleted. Was she pressured to backtrack? Was she herself a victim of the kind of political lobbying she reported on? Back in the summer of 2020, while most of the public were experiencing mask wearing for short periods, they probably considered it an unpleasant inconvenience. Few ever considered that for vulnerable people in healthcare settings, and particularly in care homes, compulsory masking of them and everyone around them had created a dystopian reality they were unable to escape. Overnight, smiles, connection, and human warmth were removed. As a former inspector and director of care homes, now self-employed as a consultant in the industry, Simon Cavadino visits around 100 care homes every year. And he saw very quickly that the masks just weren't working.
So I suppose that was my epiphany on masks. I thought, these aren't working. And I've seen this with my own eyes, not just in one place, but all over the place. You had the care home managers and the staff going, well, we're all wearing the masks. And so we've all got COVID, and the residents have all got COVID, and well, that doesn't make any sense, does it? And I thought, no, it doesn't make any sense. With little upside, the downsides of masking come much more starkly into focus. The mask mandates emboldened the various infection control departments from the local councils who basically go into care homes and do infection control work. It emboldened them to start acting in some cases like the Stasi. They turned up at care homes doing infection control inspections and sort of dramatically reporting homes where a staff member was seen wearing a mask under their chin or under their nose or something like that, as oh, these places where people could die. You know, outbreaks were blamed on care home staff and management, with the incorrect assumption that COVID-19 could only have got into the home if there'd been some breach of PPE and masking. So they were based on this like ludicrous assumption that it worked. By the time that the masks were off, everybody was heartily sick of it. And you wouldn't meet anybody in a care home that when they knew they were talking to someone safe wouldn't say, no, they're nonsense, they don't do anything, but we have to wear them. Why would you want anything to ever continue that has no appreciable upsides and only downsides? And the only upside appears to be that certain people can signal to other people about how much they're doing in order to fight something.
Valerie Nelson, an approved healthcare practitioner and trainer with a local authority, notes the total lack of any risk assessment analysis when it came to masks.
Lockdowns, mask mandates were all implemented with a total void of benefit risk analysis, and that is hugely dangerous. And I expected my social work colleagues to recognise that where was the benefit risk analysis? That is what social workers do. That is our area of expertise. But it was totally absent, and nobody seemed to be able to respond to that concern. Where is the evidence of the benefits of masks outweighing risks? It's just not there. And it can't be done, because I think it's so clear in the evidence that masks are ineffective and downright dangerous.
Beyond the lack of effectiveness of masking, the psychological damage of being in a completely masked environment was particularly profound for residents of care homes.
Very experienced care home managers said to me, I hate it when people in infection control departments say things like it's only a mask. What's the downside? They clearly have never worked here, or they wouldn't say anything so unbelievably stupid. Old people basically don't know who's looking after them when they're wearing masks. That must have been terrifying. And I witnessed this. Let me give you one example. Old people, especially those living with dementia, can't recognise their own families sometimes. You've got vulnerable people who've died frightened, confused and alone because people have been wearing masks. I remember one particular lady in a home who had dementia, and she ended up not being able to recognise her husband because of the mask. He was one of these people. He was so committed. They were so charming. He was so committed, and he visited her every day. And they sat together and they had coffee and they did activities and that. And she couldn't communicate very well, but she sort of seemed to know who he was, and was settled day to day and things. And that's what they did. And he did that every day. And then the pandemic started, he couldn't visit for a few weeks in the first lockdown, which is bad enough. But then when he could, he had to wear a mask. So he came in wearing a mask, and she didn't know who he was, and she was distressed, and she wouldn't go anywhere near him, and that was it. And that was obviously distressing for her, but it was awful for him, given that situation. He couldn't sit there and hold his wife's hand as they'd done. They'd been married like something like 60 to 70 years. He was well in his 90s, I remember that. And he wasn't allowed to take the mask off so that she could see him. Okay. She died before the restrictions were lifted. He never got to hold his wife's hand again or do that again. And this was because of masks. There are managers everywhere who said to me, I can't prove this, I have no data, but we just saw people give up during the pandemic. So that was partly due to not being able to see their families. It was partly due to not being able to see their families' faces. Someone texted me and went, the masks are coming off. And I was like, shut up. I got loads of messages, all of which said the same thing. We're so happy. Isn't this great? I can't believe it. happy joy, happy Christmas, everybody. You know, I mean, there wasn't much to it. My favourite message said, I went into the lounge and told the residents we could take the mask off. They all clapped and cheered, and then some of them cried, and then I cried. It was so wonderful and such a relief. And I'll be honest, I even slightly feel like welling up reading that message. And that will have gone on in care homes up and down the country. I don't just think masks are wrong. I know it because I've lived it. And I will say I've lived it. I've watched people live it. I've dipped into living it. I've worn a mask myself for 8 hours in a care home, but I've been able to take it off, get in the car and go home again at the end of the day. And it's bad enough doing that when you actually live it, but you actually think, this never stops for them. Morning, noon and night, this carries on. I've just had 8 hours of this and I'm heartily sick of it. When people wear masks on a continuous basis, it harms them and it harms the people around them. I've seen in the last few years a world where the infection control and the health and safety people were in charge. It's not a world I ever want to see again. It's not a world I ever want to live in again. And I'm absolutely certain if people saw what I'd seen, it would be a world that they'd never want to live in again either.
People with dementia rely on facial expression for comfort, communication, everything. It just seemed totally bizarre to me that anybody being somebody with dementia could cover their face. It did not make sense. And there being no benefit risk analysis. So even for people that thought there might be some benefit in mask wearing, if you balanced it with the risks that it was going to create for the distress, I just think it must have been terrifying for people with dementia, not seeing faces, just seeing masked faces, people wearing glasses, so whole faces being covered.
The impact of both verbal and non-verbal communication by masking was a huge problem.
Older people, again, had to live for months and live the end of their lives in a kind of a communicationless vacuum. You think about that's awful. Imagine ending your life like that. When you're in care homes, there's nothing more that you can do in a simple sense without doing anything else than smile, particularly people who live with dementia. If you smile at somebody living with dementia, and a genuine smile, they smile back. They almost always do that. You know, they're confused enough as it is. They don't know who you are, but with the greatest respect, they don't know who their own families are sometimes. But if you smile, they know that, and they'll smile back. And the simple act makes both parties feel happier. By masking everybody up, you almost instantaneously, or the government almost instantaneously, took away the joy from care homes. And the joy disappeared from care homes for 2 3/4 years. It's so simple. Smiles spread happiness, covered faces don't.
Lots of older people have hearing impairments too, and so they rely on facial expression to understand the approach of somebody who's trying to communicate with them. And I, for years in dementia awareness, have been talking about the importance of a smiling face, that about no matter what you're saying, somebody can't comprehend perhaps your words, but they can see your demeanour and what your facial expression is telling them. That is probably the most important area, about removing facial expression for somebody with dementia who's relying almost totally on facial expression, not just for communication, but for comfort, for easing stress and distress, for easing loneliness. To remove that, I think, is just the epitome of cruelty. People, when masks are around, they're less likely to initiate conversation, engage in conversation. They're less likely to sing, or just the things that are about pleasure. They'll miscommunicate too if somebody's asking them if they want a drink. So there's a miscommunication bit that they'll not even know if they're being asked if they want a drink, and perhaps say no to something that they want. So there's just the reduced opportunities for conversation, for chat, for banter, just the things that are so important just in life. I just can't emphasise how awful it must be for people.
Brian, a paramedic of 11 years, saw the negative impacts of masks on communication almost immediately in his work.
But you would see some people unable to understand what you were saying when these masks were on, because a lot of the elderly are hard of hearing, so they use visual cues to understand what you're saying, and it was real problematic at times. People, particularly with dementia or some cognitive decline, would really struggle with what was going on. And also as well, a lot of these elderly people, they're in the house by themselves, and particularly during lockdown, they were isolated. Perhaps when a healthcare worker or a care worker or somebody or a community worker who's went in to go and visit them, that's probably the first person they've seen in days and weeks. And somebody's wearing a mask, right? And sometimes you're seeing somebody smile and giving you a happy hello, how are you, can make that old person or that individual's day. And then all of a sudden that barrier's now put up.
The physical harms of masks have been ignored too, but Valerie explained how dehydration from being unable to drink regularly due to mask wearing caused a nurse friend to develop a urinary tract infection.
It was a very direct harm from wearing a mask, and the breathlessness and exacerbating skin rashes, all these things, but very, very inhumane and dangerous. Expecting them to manage, she was working in a ward with people with dementia who were highly distressed, and to have to manage behaviour that is challenging to understand and make sense of with a covered face. I've worked in that setting, in a hot, stuffy, challenging setting, so I've done it. I know how hard it is. I can't begin to imagine how you could do that job with your face covered and not being able to breathe properly, not being able to take drinks freely. I think just what is totally underestimated has been the harms to people wearing masks for long periods of time. For health and social care workers, people in care homes and hospitals tend to do 12-hour shifts. Now, to be wearing a mask for 12 hours and all to have your breathing restricted for 12 hours, in my view, is just intolerable. I don't think there's been sufficient awareness of the harms it was doing to people on numerous levels.
In hospitals, one nurse who prefers to remain anonymous for fear of how her employee could react actually took her NHS trust to court over being forced to wear a mask, despite, she says, having a disability. We'll call her Claire. Forced to work in a mask for 8 hours a day, Claire experienced physical problems she said made her care for patients unsafe.
When I was doing IV infusions and stuff like that, I couldn't actually read anything very well. You need oxygen. So I was unsafe to practice, for sure. I did say to him, I can't function properly wearing these masks 8 hours a day, but I was completely dismissed.
Claire's legal case against her employer wasn't successful, but she was moved to other work. She's defiant.
Just waiting for them to come back up to me and say, I need you to wear a mask again. I'm just going to say, I'll take you to court again. I wish they would do what I've done, because in the end of the day, even though it's been horrific, I feel proud of what I've done, not just for myself, for my patients, for my friends, for everybody, that I stood up. And if you get a chance of standing up, please stand up, because this needs to stop. This definitely needs to stop. They can't keep doing this to us. They can't keep masking us up. As a healthcare professional, consent is so important. You wouldn't touch a patient without their consent. And for some reason, it just went out the window in 2020 and onwards. And I'm shocked that these healthcare professionals allowed this to happen.
What will it take for the suffering caused by masking in health and social care to be officially acknowledged? And what can be done to prevent it in the future? Few members of the public are even aware that a Scottish COVID inquiry happened, but it has been far more open and impartial than the UK's main COVID inquiry. Alison Walker, a former BBC presenter, had both of her parents residing in care homes in 2020. She told the Scottish Inquiry about the role of masking in her parents' decline.
If you're surrounded by a group of people 24/7 wearing masks and you don't see people smile for up to 2 years, what kind of effect is that going to have on your mental health and well-being? And they're wearing masks, some care homes are still wearing masks. Surrounding residents of care homes with people wearing masks for such a long period had a huge impact on them. This, in conjunction with isolating them from their loved ones and everything they know, was catastrophic.
Susanna Napier, a social care worker and union representative, told the Scottish Inquiry about the physical symptoms she and her daughter endured as a direct result of prolonged mask wearing.
I've never in my life ever had sinusitis before, and I had it really, really badly, and still at times suffer for it. I feel that had a real detrimental effect to myself, and I know that there are even people within my family are suffering from it. Regular sinusitis now. And my daughter's a nurse, her face would be red raw, literally, with wearing the mask.
But patients and staff in health and care settings aren't the only ones damaged by this. Respect for institutional science has rightly taken a hit, as Professor Peter Horby told the UK COVID Inquiry. During peak COVID, Horby was part of a high-profile group of scientific experts regularly advising SAGE. He told the Inquiry that the group had previously examined the issue of face masks and, taking a strict scientific approach, concluded that the evidence supporting their effectiveness was weak.
Sorry, I'm not following Sir Peter. If there's a possible benefit, what's the downside?
That you are making a population-wide recommendation based on weak evidence, which may weaken trust in your scientific independence and integrity.
But why would scientists and health bureaucrats force the public to wear face masks on pain of fines if they knew the evidence didn't support this extreme measure? The most obvious explanation is that forcing the public to wear masks was a highly visible way to be seen to be doing something. But in creating their own feedback loop of fear inflation, it almost became impossible to take the masks off again, even though, as Simon Cavadino explains, there was actually nothing to stop the care homes from doing so at any time.
There's never been any guidance from the Health and Social Care Act that has mandated the wearing of masks in care homes from July 2021, which was when the coronavirus laws were retired, if that's the right phrase, when there was that opening up stage, as it was called. And at that point, there were no laws ever that you had to wear a mask in a care home. But the Department of Health guidance basically said that there should be, I think the phrase was universal masking, which basically means everyone wears a mask all the time. But that was guidance and not law. As far as I was concerned, they could write a risk assessment, much like the example I was talking about earlier, or the examples I was talking about earlier of someone who can't hear, for example. Well, we can take the mask off and talk to them because then they can hear. That promotes their well-being. There's a very important point of consent as well, which is that most people would have said, I'd rather you take the mask off. They understand what they're doing. So, okay, they've asked us to take the mask off. We will do that. We understand that there's an increased risk of infection, even assuming that that was the case, but let's go with that for now. And because we're trading off one thing against another, we've decided that it's worth the slightly increased risk of getting infection in order to promote that person's well-being. To be fair to the Department of Health guidance, it actually said that, and it invited care providers to do that. No one did. No one did, because of the appropriate, even when I explained it to them, that this was the legal position, and if anybody came for you, this would be legally bomb-proof. There's no, people would say, oh yeah, no, all right. I'm talking about senior directors here who I wrote this to in clear terms, and they read it and they go, well, yeah, okay, we know you're right, but there's the political dimension. I thought, well, yeah, there is the political dimension, you're right. But as far as the regulations were concerned, there was never any need for people to, universally wear masks in care homes. I wanted the big providers to to take this on in 2022 and say, we can see the harm it's causing now. We don't think there's any appreciable benefit, or even if there is a little bit of appreciable benefit, we don't think it's worth the harm it's causing. And so therefore we're going to write our own risk assessments and our masks are going to come off. And if the big providers had done that, the little providers would have gone, and like the fall of the Berlin Wall, it would have been done in 3 days, and that would have been the end of it.
Valerie Nelson agrees that most in the care sector knew full well of the problems, but were frightened to speak out.
That from my experience, the majority of health and social care workers understand the problems caused by masks, but such was the level of fear around, they were having to manage the fear of the population alongside, the government instructions, the guidance that they were given, and I think it must have been hugely difficult to manage. So that's controversial, isn't it? That if they had all clubbed together, and I suggested that at one point, if everybody got together as a group, then that would be effective of no one person standing out on their own, but that didn't seem to be an option. I spoke to a CEO of a UK-wide charity who, reflecting on what happened in 2020, recognised that the harms that were done, and they would respond very differently in the same circumstances, which is really encouraging for everybody. And I think many people are traumatised by what happened and don't want to revisit what happened, but we have to revisit and keep mask wearing on the agenda, so that people are almost, especially health and social care professionals, almost have to be put in the position of reflecting on what happened to ensure that it doesn't happen again.
Even into 2025, some healthcare settings are still trying to impose their own mask requirements. Dr. Gary Sidley is a retired NHS consultant clinical psychologist who since 2021 has been part of a campaign group, Smile Free, who have been fighting an ongoing battle against masking and working to prevent a repeat of the horrors inflicted on the most vulnerable.
Back in summer 2022, Smile Free wrote an open letter that managed to attract the signatures of over 2,200 scientists, professionals, healthcare professionals. This letter was directed at the chief executives of England, Northern Ireland, Scotland and Wales, asking them to change the guidance so as to allow individuals the choice of whether to wear a mask or not. It seemed perfectly reasonable. And you ask, what was the response to that letter? Well, the response, I would say, was rather unconvincing and a little bit comical as well in some respects. Dame Ruth May, who is the lead for infection control at NHS England, responded on behalf of the chief executive. And in her letter, she highlighted that it was often down to local discretion as to whether individual healthcare trusts impose mask mandates again. Local discretion is supposed to mean doing risk assessments and looking at the prevalence of viral infections in your area, and to document those kinds of things before you impose a mask mandate. And subsequent freedom of information requests by Smile Free to these 8 NHS trusts who have imposed mask mandates over the last 12 months came back with one resounding answer. They do not do risk assessments and they do not monitor the prevalence of viral infections in their area. So what Ruth May said in that letter was inaccurate, this idea of local discretion and doing local risk assessments. The other rather comical thing in the response was that she highlighted one study in support, so she said, of masking in healthcare. And lo and behold, this was a modelling study. And we know what the track record of modelling has been throughout the COVID event with Neil Ferguson and others. And actually, on the front page of this modelling study, the authors had actually stated in the front page, these results are uncertain and should not be used to inform clinical practice. That's what he actually said on the front of the paper. Yeah, so why are a few NHS trusts and hospitals persisting with masks if they're ineffective and cause harms? That's an interesting question, and it's open to speculation as to what the key reasons are. I think for me, one of the key factors is the woolly guidance. The UK Health Security Agency, in its latest guidance, broadly talked about NHS trusts transitioning back to pre-COVID practices, which was kind of a woolly statement, because it also had a clause in there that talked about, you know, the local services can adapt this kind of guidance based on the conditions in their particular area, as long as they do some risk assessment, and also as long as they estimate the kind of level of infections in their particular locality. In practice, of course, those assessments never happen, but we've got lots of freedom of information, request evidence that doesn't happen. I think another issue why some professionals and some of NHS trusts persist is that in some ways it kind of gets them off the hook a little bit as well, because, you know, if they say, oh, you must all wear masks, you know, when you're moving around the community, and if compliance with that isn't, you know, kind of 100%, which it's never going to be, you know, if things go wrong or if there are negative outcomes, they can kind of, you know, get themselves off the hook by saying, well, you know, if people had worn them properly, this would not have happened. If people had followed our guidance, you know, this would not have happened. If you're a professional, or if you're an academic, or if you've been on the SAGE committee and have been energetically pushing masks throughout the COVID event, or at least from June 2020, it then is quite difficult to do a U-turn and start saying, no, I was wrong, or, you know, masks don't work. It takes a very brave person to do that, and I'm not sure many are up to it.
4 years on from telling the public that masks were a bad idea, it seems Dame Jenny Harries would prefer not to discuss the issue at all.
The letter we sent to Jenny Harries, the chief of the UK Health Security Agency, on the 2nd of November 2023, you know, what we were asking her to do? Well, we were asking her to explicitly discourage the wearing of masks in healthcare settings. You know, there's this group of what we might call outliers, NHS trusts, just a few of them, not a huge number, 8 at the last count, who have actually reimposed mask mandates at certain points in time over the last year. So we wanted her to explicitly direct them, you know, not to do that, to discourage them from doing that. And in addition, we also wanted her to make explicit the fact that the evidence that masks actually work is pretty slim, as she has said on more than one occasion. And we also, importantly, because these are always ignored, we wanted her to state that masks do come with a range of potential harms, physical, social and psychological, and to make that very clear to these NHS trusts that were still persisting with their mask mandates. Up to now, despite a prompt, we've not yet received an answer from Jenny Harries to that.
As the COVID saga has receded, the most recognisable players have mostly disappeared into the sunset. For them, there were brighter days ahead. Unfortunately, many in health and social care settings were not so lucky. They ended their days with everyone around them masked. As the writer Sean Welsh put it at the time, there is a very modern assumption that to live is just the same thing as to be alive. But the face is a primary engine of social interaction, and to compel us to cover it up is an act of spiritual vandalism. Our smiles, frowns, and other expressions remind us that we are not just bodies, but also persons, not just objects in the world, but also perspectives on the world. The reason why wearing a face mask seems strange has nothing to do with it being a novelty. It is because it is unnatural, in the sense that it goes against our nature as persons. It is unthinkable that this could ever be repeated, yet without bravery and leadership from health and social care sectors, we are at huge risk of reliving this nightmare.